Hello everyone, myself Dr. Rajesh Khanna, Consultant Pediatrician, KIMS, Cuddles, Kondapur branch. Today I will discuss on poor weight gain in children. This is also again a common complaint for which children is brought to the pediatrician, because weight is an ultimate predictor for child's well-being actually. So if the child is unhealthy or not eating well, or there is some deterioration in the body's system, then definitely the outcome is poor weight gain. So initial days when the newborn period is there, baby is not fed enough milk at least 8 times in 24 hours. Mother's milk is not enough, or mother is not well motivated in breastfeeding, and child is fed with any other alternate source of milk, especially animal milk, and which is not that easily digestible by the newborn baby, and also there are some underlying health issues. What happens is the child will not put on weight. 1 kg in the first 3 months, 1 kg every month in the first 3 months is usually expected, at least 800 grams per month in the first 3 months. If that is also not being happen, we call it as failure to thrive, and such babies needs urgent attention. Otherwise, if this is allowed to happen like that, this malnutrition or this poor weight gain issue can have their serious impact on delayed brain development, and milestones can be delayed, and future school performance or future child's immune system and all the rest of the organs also will not be properly matured or developed. Now in such scenarios, if intake itself is insufficient, we try to compulsory enhance intake of milk, and for older children we try to energy dense or consolidate calories, and we give energy dense foods, especially starting from 5 months onwards, 5 months 15 days onwards. When complementary foods are given along with milk, energy dense foods needs to be considered, because they eat less quantity, so that they cannot eat more and they cannot get more calories. So you have to concentrate all the calories in that little food what they are consuming. Now the problem is with the fussy eaters, when they are picky and choosy, especially when it is parent made mistake that showing televisions or cell phone, iPad, associating screen with the food. When child loses interest in the food, they don't accept the food, and they don't know what is the quality or what is the taste of the food. They are eating unknowingly. Ultimately, one or the other fine day they stop eating and refuse to eat anymore. Their attention and concentration is more in the screen. So please don't associate eating with screen. So you can present the food in different various forms. So quality of the food is in parents' hands, and quantity should be in the child's hands. That's how you encourage the child to eat more. And having said all this, the other main problems of health can be protein loss. When there is serious protein loss, there is proteinuria, the child may not gain weight properly. Having serious underlying health issues, that is the child gets any pneumonia attacks or falls sick repeatedly due to frequent respiratory infections, and acute gastroenteritis, especially throwing diarrhea frequently due to unhygiene, and also having some serious cardiac abnormalities or some orofacial developmental anomalies. So there also the child cannot eat, or even if they eat, they don't digest properly, and due to repeated infections, malnutrition sets in, and due to malnutrition, infection sets in. So that's why you should treat the underlying cause, then only weight gain can happen. Also, having said that, worms can also be a serious threat in poor weight gain. So deworming as a protocol starting from 2 years age onwards, every year till at least 5 years of age, yearly deworming is done as a protocol. So assuming that because due to eating of uncooked foods, especially kira, carrots or beetroots, or these foods can carry some eggs, larvae, worms in the food, and due to which they may develop worms in the intestines. So definitely focus on anthropometry, that is weight, height and head circumference in the first 2 years, and thereafter weight and height and body mass index. and detect if the child is not gaining weight properly. Some health investigations like complete blood picture to rule out anemia, iron deficiency, as well as urinary protein loss, one complete urine examination. So these are the preliminary things which you can do. This is my advice for today. Further details you can consult pediatrician. We will let you know in detail. Thank you.